Good morning, everyone. Scott Maybor here with your Medicare Missive from the pond for Monday, August 10th. Hope you're doing well. Hope you enjoyed your weekend. Today I wanted to talk to you about the differences between Part B, as in boy, and Part D, as in drug, plans, and drugs that are covered under one versus the other. So last week I spoke to a doctor and his wife. So he is an MD. He's retiring from a large hospital network here in the Boston area. That particular network has their own health insurance plan. They offer it to their employees, so he and his wife are currently on it. They also have a Medicare Advantage plan, actually 5 of them, that are available to the general public. And when my initial conversation a couple weeks ago, that's what they want to be on. They've been happy with it. They'd like to stay in it. All their doctors are at this hospital's network. So we had an initial conversation. We talked about what's the difference between the 5 plans. 3 of them are, I believe 3 are HMOs, 2 are PPOs. There's a 0 premium PPO. There's a $350 a month PPO. There's a couple HMOs. One is around 60, one's around 150. The truth of the matter is, though, in looking at these plans, and they had settled on, I believe, the $100 plan, and then I pointed out that's an HMO. You need referrals. You can't go out of network. Okay, well, we really prefer a PPO. Which PPO makes sense? And you start looking at, there is a PPO in the middle somewhere. What's the difference between a 0 premium PPO and a PPO you pay for? So that was one conversation. And in my opinion, usually not much. Lower max out of pocket, some lower co-pays, but not always. It's usually the max out of pocket, the daily hospital charges are usually the big differences. And you may get a little more dental or something like that. So he was leaning towards paying for one of these plans. Okay, not usually my recommendation, but fine. And then he calls me up that his wife's, he started doing some research. One of his wife's medications is not on the formulary. Okay, so I don't remember the name of the drug, but it's injected into her eyeball by a medical professional. So because it's injected rather than self-administered, and it's not picked up at a CVS or a Walgreens, it's something she goes to a doctor's office or a clinic for, and they do the procedure. It comes under Part B, as in boy, not Part D. Part D drugs are the things typically you're going to pick up at a CVS or get mail ordered to your house, and you're going to take them yourself. A Part B drug is something that gets administered to you. So he was very upset. Her drug is not listed on their plan's formulary. The formulary is the Plan D drugs. And I said, well, that doesn't matter because it will be covered under her Part B. Now, Medicare pays 80%. If you have an Advantage plan, so she'd be responsible for 20%, and of course the drug is thousands and thousands of dollars, plus there's a procedure involved in getting this administered. So I said she could go on the Advantage plan, even though it's not listed on the formulary, it will be covered. However, what's the copay? And that's what I don't know. And if I call the carrier or the rep, they're going to tell me, we can't tell you because we don't know how they're going to code it. So it could be simply coded for the drug. And in that case, it looks like she's going to pay 20%. Could be coded as an office visit plus the drug. Could be coded as an outpatient procedure and not pay separately for the drug. And those all have different levels of copay. But I said, if they do a procedure, it's $350. If they do it as the drug, you're paying 20% of a $6,000 drug. It's unlikely they're going to do it as just an office visit. So what's the safer thing to do? If you take a supplement, it's free. 100%, the 20% is covered. Whether they do it as an office visit or a procedure is fully covered. So I said, you can try the Advantage plan and see how your doctor codes it and see what it ends up costing you that first month. Or you take the supplement, which is around $250 a month, and you know it's free once you've met the annual deductible, which is $300. So if you go with the supplement, it's going to cost her $300 most likely when she goes and has this done later this month, or excuse me, in September. But that's it. it won't cost any more, and it's free after that. It does cost her $250 a month. If she goes with the Advantage plan, I can't tell her what it's going to cost because I don't actually know. He was still interested in the Advantage plan from the network, and I said, there's no reason you don't take that. You can still have an Advantage plan. You can be on that. You don't have the eye injection. She does. So be very careful when you're looking at your drug list. If it's something that's on if it's something that's administered, it's most likely a Part B, not a Part D. And if it's on the Medicare list, it's covered. However, an Advantage plan is going to have copays. And if you can't get your doctor to narrow down how they're going to code it, and the doctor's not going to know, you call the billing office, they may or may not tell you. I told her she could check. Without knowing that, I can't tell you what the copay is going to be. And without knowing what the copay is going to be, you may find that the Advantage plan with a $7,000 max out of pocket ends up being much more expensive than the $250 supplement. Let me know if you have any questions or comments. Please like, please share, please follow me. And please like me on Google. Let me know if I can help. Have a great day, everyone. Thanks for watching.